on this episode of A Tale of Two Hygienists.
When we look at biofilm, of course, it's not just plaque, it's a complex ecosystem. And that's what we're trying to win the war against when it comes to inflammation in our patients. As hygienists, we have to build the value for the dentist, and the dentist is looking at KPI only and looking at costs and not necessarily looking at that patient experience and the experience of the clinician. We had hygienists who have been practicing for 20, 30 years who equate an air polisher with just solely supragingival sodium bicarbonate that's not warming the water, that doesn't have constant hair. So they're used to having to deal with clogging and having it be messy. But the reality here is that we've got better tools now to reduce all of those objectives that the clinician and the patient have. So my patient's perspective is, wow, this water is warm. Wow, this feels so much better. And of course, I'm still going back in because there is importance to using those instruments.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome in, everyone, to this week's bonus episode brought to you in partnership with the HuFriedy Group. I'm your host, Andrew Johnston, and do we have a treat of an episode for you today? Today, I'm joined by amberaugerrdh to speak about HuFriedy's PWR Pair, which is a combo piezo unit and air polisher. We talk about its capabilities, we talk about how to use it in comprehensive care, and the importance of a tool like this as our profession continues to evolve. It's a really great episode. We're really excited for you to give it a listen. Don't forget to check out the show notes for links to the unit and other awesome things the HuFriedy Group is doing for us dental professionals. Okay, on to the episode.
A tale of two hygienists.
Listeners, welcome into the interview portion of the podcast, joined today by amberaugerrdh. Amber, thanks for being on again.
Thank you for having me.
A repeat guest. We're here at RDH Under One Roof, and you're here representing the HuFriedy Group. We have something pretty interesting, something new to talk about today. But let's just jump into it. Let's talk about where your passion drives you and what's going on with you today.
Absolutely. Well, thank you so much again for having me. And I can't thank my friends at HuFriedy Group enough for allowing me to be here. And really what I'm seeing is just a shift in the perspective of dental hygiene. And let's be honest, this shift has been happening slowly for the last 15, 20 years of focusing away from the hard deposit and really focusing on how we can empower our patients to remove biofilm, right? The root cause of this disease. When we look at biofilm, of course, it's not just plaque, it's a complex ecosystem.
Yeah.
And that's what we're trying to win the war against when it comes to inflammation in our patients. So I'm excited to share this technology with you and kind of share my philosophy with how I practice clinically.
You have a different perspective, I think, than a lot of hygienists do, because you get the opportunity to kind of travel really the world. I mean, you travel extensively throughout the U.S. You talk to a lot of different dental hygienists. I kind of want to dive into a little bit deeper on the shift in mentality a little bit, because when did you graduate again?
2010.
Yeah, so we're around the same age. And so I feel like, yeah, for both of us, everything was geared towards those hard deposits. I mean, especially even board exams, right? It was like, hey, this is the thing that's going to help our patients get healthy, but it's really just not the case. And so everything that's been created for us is about basically manual removal with a metal stick and trying to get the patients healthy. Do you feel like the hygienists are really embracing this kind of evolution of this change?
I do. I think where the roadblock comes is, as hygienists, we have to build the value for the dentist. And the dentist is looking at KPI only and looking at costs and not necessarily looking at that patient experience and the experience of the clinician. For me personally, I graduated hygiene with carpal tunnel, and I've been practicing with some sort of air polishing device since 2010. Now, those original air polishing devices were targeted on supra only. Now the innovation is targeting sub and really focusing on, this is a therapy, you're having better patient outcomes. So I'm spending less time pushing around plaque and now decontaminating, detoxifying, and eliminating that plaque subgingivally within seconds. So my patient's perspective is, wow, this water is warm. Wow, this feels so much better. And of course, I'm still going back in because there is importance to using those instruments, those hand instruments, to
Absolutely.
target the deposits and to ensure that we're creating a smooth surface for that tissue to heal and stick with. So I think when it comes to this, I think we've got the hygienists who are early adapters who are like, oh my gosh, yes, I know this. And, there's other brands out there that have systems of a wheel that here's what you have to do in the steps. And I've worked with those systems as well. And there's a lot of good with that, with helping transition a hygienist of using something that is different,
Sure.
right?
Sure.
And we get in this mode of here's what we do at this point in the time, but this is causing us to really think critically and expand what we are doing chairside. The beauty here is the time saving, so we can have in-depth conversations with our patients about other things outside of
Yeah.
the just, your teeth are stained and what have you been using? And oh my gosh, now on my eighth prophy cup, flaring the cup underneath with it, harming that clinical attachment loss that's present there. So I think it really requires us to be thinking about, yes, there's ROI with time. Yes, there's ROI with having less plastics. Yes, there's all of these ROIs, but what about doing the right thing for the patient?
Thank you. Amen. Well, and it's funny too, because like you were saying about like, hey, we've had air polishing for a long time, and I remember the dentist would always be like more nitpicky about this little tiny piece of stain that I missed, and then that's when we get the air polisher out, right? Is like a focus on this stain that is not the root problem, right? They're not the root cause of all these things. How do you feel like the dentists are also evolving? Because I've seen a huge shift in the mentality, especially the new grads, in moving away from, hey, Andrew, hygienist, Amber, hygienist, you missed this hard deposit, you missed this piece of stain. Do you feel like they're also jumping on board with this, or they're supporting their hygienists in this endeavor, this evolution for them?
I think it all depends on how the hygienist pitches it to the doctor, right? Because they're making the investment in most of these situations. And then I also think it just depends on what their overall practice philosophy is. The beauty of using a glycine powder around restorations is that we can also help preserve them. So I think it just depends on the practice philosophy. I think it depends on how the hygienist presents it. And at the end of the day, I work with so many doctors who actually want to get it, but their hygienists are hesitant. So this is what's so beautiful about RDH under one roof. Yesterday, I was working the booth, and we had hygienists who have been practicing for 20, 30 years who equate an air polisher with just solely supragingival sodium bicarbonate that's not warming the water, that doesn't have constant hair. So they're used to having to deal with clogging and having it be messy. But the reality here is that we've got better tools now to reduce all of those objectives that the clinician and the patient have.
Do you feel like they look at it also from a longevity standpoint? These hygienists that you just were working with, they're 20 and 30 years in their profession. They're like, you know what? I actually do want to extend my career a little bit longer. I can't be doing the same old things I did the first 20 or 30 years because it's just ergonomically not going to be possible. Are they looking at it from that perspective, or is it mostly just, like you said earlier, doing the right thing for the right thing?
I think it just depends on where that clinician is in their career.
I want to go back into the glycine thing, because that is something that was also relatively new information for me. When did this start becoming a popular addition to our armamentarium?
Absolutely. So I think really glycine has been around for years and years and years. When it becomes popular is a different question,
Okay,
right? So it
yeah.
just depends on your territory, how well you're educated, and we see a really slow transition. Like it's always fascinating when I'm lecturing. I'll go and talk about resin instruments, or I'll be talking about a glycine technology, and they're like, "Oh my gosh, I've never heard of it." Versus other audiences who are like, "Yeah, where have you been? It's this isn't new." So when we look at glycine, the really beautiful thing of this is it's safe around implants. It's also great at removing stain. So not that super heavy beetle nut stain, but your average stain of your patient. So for me personally, I'm often working with glycine powder when I'm chairside.
Is it a particle size thing? Like what is the thing that makes it so effective?
Yes, great question. So it is a particle size thing because you can go supra with it and sub. So what's beautiful is I don't have to switch tips or find that I have to with the HuFriedy group powder itself. It comes with two different chambers. So that's unique, a unique design. But in other units, I would have had to get up, change my overall powders, and not be able to quickly rotate seamlessly between super and sub. So the reason I love glycine is I find it's less technique sensitive because I don't have to worry about that tissue trauma. So if my angle is not perfect, it's okay with a glycine.
I find that like subgingivally, like sometimes it feels like, especially ulcerated epithelium, it's a little bit more prone to trauma. Is there any concern right there with glycine at all? Like you should never ever be concerned with trauma.
I don't, if, when you're using it correctly. So if you were to stay anything that you're using as far as a power instrument, if you're not using it with the correct angle and you're staying there too long, yeah, you could cause trauma. However, with glycine, because it is safe around implants, because it's safe around those restoratives, it's less contraindicated
Okay.
versus a sodium bicarb, right? We have to be good stewards with the powder that we have.
Absolutely.
Mm.
Absolutely. Okay, let's talk about the comprehensive care. I feel like comprehensive dental hygiene has also kind of taken a little bit of a turn over the years, I would say, in our even on just our little short careers. I think that we thought that we were doing comprehensive care. We weren't maybe necessarily. Let's talk about that a little bit. What's your interpretation of that?
So comprehensive care, I think, is really about focusing on meeting the patient where they're at, where we can build a foundation for why they have the disease that they have and turn it into more empowerment instead of shaming. So looking and disclosing with the patient and talking about, well, of course you have a higher risk of tooth decay. Your baseline is more acidic. Okay, let's talk about the food you're eating and the beverages you're drinking. And let's talk about why you're at higher risk. So when patients can understand, well, just from my medical history, I'm coming in at a higher risk because of my high blood pressure or because of all of these medications I'm taking that are causing the xerostomia. Now we can flip that and have empowerment. So I think it comes to starting with compassion. I think it comes with asking the right questions with the patient in the past. What have you not liked? And then it's all about setting them up for success. Whenever I'm working with my air polishing device with the PWR Pair, one side's a piezo, one side's the air polisher, I will intro, and I work with this every patient every time. So it's a lot throughout the day, which I'm so grateful for. But when I'm working with my patients, I will say, as we get started, I'm going to use this overall air polishing device. We're really excited to offer this to you. We're targeting and eliminating the root cause of these pathogens right now. We're really targeting that pathogen to decontaminate. And it's going to start off warm. It's going to get a little warmer as we go, but it won't get hot. And little things like that that you can set them up for where they're not sitting in the chair like, oh my gosh, this is warm. Is it going to get hot? I'm terrified. And they're shifting. Now they're like, oh, okay. These are my parameters for success. She said it wouldn't get hot, right? And then checking in on them quadrant by quadrant. Checking in, you're doing great. And most of the time, the patient doesn't even want me to stop. They're like, yeah, hands up, this is awesome. And then from there, it's, how come no one's ever used this on me before?
Sure.
And I said, well, I can't work without it.
Yeah.
So in my practice, it came with me going into a practice that's traditionally rubber cup and saying, listen, let me try this for a week and show you the reviews that we get.
Yeah.
And we've had over 25 reviews just from our air polishing, where
Really?
new patients who are saying, wow, it was comfortable, it was thorough, I've never felt so clean, but it was painless. And that's
Yeah.
always my goal.
Yeah.
Yeah.
Well, I think that's another thing too, is like that the hygienist wants to be able to prove to the practice that they provide value, right? Part of that is in the reviews, right? So you got to kind of change up what you're doing, be a little bit different, as long as, again, going back, doing the right thing for the right reasons, right? I think sometimes though, when we want to try and do the right thing, it's just another thing, right? It's like, oh, freak, we have to do something else. How do you manage your time? How do you manage like the sequencing of events to make that actually work?
Well, time management is my specialty, so I'm so glad you asked that. I consider myself a time management ninja, and I think that if you as a clinician are not in control of your time chairside, it's going to compromise your care. The quality of care that you give, it's also going to compromise you. Because if you're constantly running behind and having that stress day after day after day, you're going to hate being in the operatory. So a lot of it comes down to how you audit your day. But the foundation here is assessing first in that 20 minutes. Because if you start where you are blindly going in and starting to treat, where you're not doing an overall assessment of where their gingival health is currently, note I'm not saying probing.
Right.
You're measuring their gingival health and you're looking and you're disclosing the patient, you're going to set yourself up for failure. What's going to end up happening is you may experience tissue that looks nice and healthy on the top, and then you get in there with a scaler or your air polisher, and you're seeing there's disease, your 5-6 millimeter pockets. So really the assessment stage is that first 20 minutes, and that's really important. And then you can figure out what you could do from there. The beautiful thing with air polishing is I actually, if a patient comes in, they need a full mouth debridement, they need scaling and root planing, I'll actually air polish them first. And I'll send them out, and then we'll have them come back in for that scaling root planing, and I'll air polish again, super and sub, but it's setting that patient up for success. I've had hygienists say, well, if you polish first, they're not going to come back. And I say, If my patient believes that I'm just here to remove their stain, I've not done my
I
job.
said, yeah, we've screwed up somewhere along the
Yeah,
lines of
so really it's more
communications. Yeah.
education, and the thought process around doing the air polishing first is to decontaminate and set that tissue. It's to pre-optimize that tissue.
Mhm. The time though to disclose is 2 seconds, right? Like, does take anything for us. I feel like there's a barrier though for sometimes for hygienists where they're like, "You know what? That's for kids," right? That's for whatever.
Oh,
How do
absolutely
we
not.
how do we break that mentality though?
Well, I think it depends on what you're using for disclosing, right? Because in my experience with disclosing products, you can go through and disclose the patient, and then all of a sudden it becomes like a confession. Like, oh my gosh, I just had pretzels. I'm so sorry. I was starving. It's like all of the reasons why they must have that plaque present.
Yeah,
But if you're using like a timestamp disclosing,
sure.
then you can see so much data. So there's timestamp disclosing out there that looks at the pH of the mouth, looks at how long it's been there. And the beautiful thing is this also is my roadmap because for education for brushing, but it's also my roadmap when I am using my power technology because now I know where to stay. Now I know exactly where that biofilm is. Now I can make note, oh, there's acidic plaque over here. Let me reevaluate. Does that patient need a Curodont on that, overall buccal surface where it's a white spot lesion? Because now when I'm there, all of that is almost like calcified plaque, that like
Yeah.
sticky cottage cheese,
Mm.
orangey has been there for a couple weeks plaque.
I feel like sometimes hygienists are a little bit not as confident as you or I might be in having the conversations with the patients. Can you quickly just walk us through, like, okay, let's say that we find and we're using the time stamped disclosing agents. How do we have that conversation without offending the patient, without making them feel bad, without all of the different things? Because we do want to do the right thing, but we're going to shy away from it because we don't want to hurt feelings.
Absolutely. So what I typically do is I will disclose, I'll hand them a mirror and I'll say, what do you see? And I just put, yeah, what do you see? What do you notice? Right? This is our truth serum of where you've been overall brushing and flossing. And I always start with, this doesn't make you a bad person. This is just to set you up for success. So I know that you said that you're concerned about your inflammation. I know that you said you're concerned that your parents always had tooth decay. And looking at your films, looking at your assessment here, you don't have a defect in your enamel. This is really a root cause of a pH issue, and look at all the blue you have. So that's really where it comes into play is showing the patient evidence of the disease and then leading with compassion and motivational interviewing to help them understand that I'm not judging them, that I've also struggled with this. And I'll say this, I struggle with this as well, right? Because we get busy. Life is busy. So that's really where we have to be focused on with the patient of leading with compassion, sharing with them this is what I see. And if that patient becomes combative, this is our roadmap of where we're going to go and picking up the device that you want them to use, whether it's an electric toothbrush, whether it's with tapered bristles. I always love having a manual tapered bristle brush right next to them where I can see how this easily comes off. So that's the beautiful thing. As long as I can be an amazing hygienist chairside with you. I can decontaminate everything. I can remove every speck of calculus and biofilm. But if you are not doing this on a daily basis, we're not going to get the results that we want.
Let's continue through that process. So you do your disclosing, you do your air polishing, and then you use your piezo at that point.
Correct.
Hand scaling. Talk about when like lasers are a part of this process.
So it all depends on what saliva I'm treating. So I do salivary testing and I figure out what is the pathogens present. Do we have AA? Do we have PG? And that kind of sequencing comes into play. It's really complex. A lot of it comes down to what's present, what bacteria is present. I can't answer it without it's specific to the patient.
Without without doing some more tests first.
Yeah, I'm like, let's pull up some radiographs. Let's
But it
walk you
leads
through.
to the conversation though. Like we need
Right.
to be doing more for the assessment phase.
Right.
Like it's and you're right. Like we always think about just metal sticking gums is kind of like our assessment phase, but that's not the assessment phase. There's so much more that goes into it. As we're kind of like winding down here, like we still need to talk about implementation. We need to talk about like how are we actually going to get hygienists to one, opt in, understand the philosophy, embrace it, implement it, but also how to get that onboarded into their practices. So can you talk to that point a little bit?
Absolutely. So I think most hygienists are excited about it. When I look across the board, I would say many hygienists have heard about air polishing. If they're on the fence about implementing it, it's more because they haven't looked at the new innovations around air polishing. The previous innovations were simply to remove stain. Now it's just a different philosophy approach. So I would say that. And then I would say the best way to kind of transition this is be involved. Go to your CE. HuFriedy Group does an amazing job with their CE. We just did a hands-on overall segment yesterday here, and we had great feedback. And going to trade shows and actually having the units. HuFriedy Group, has units here where you can try and demo, and it's all about talking with other hygienists and figuring out what's the why behind your hesitation. Right? So I see so many hygienists stay stuck in offices they don't belong or using technologies that don't serve them because they're terrified of changing. And we have to keep an open mind to continue to evolve how we approach preventative hygiene, as well as sticking together, right? The reality is our profession right now is at a really huge crossroad, and it's terrifying when we think about it. We have to band together no matter kind of what our walk of life is and our political beliefs, and know that we all are one of hygiene and we want to progress forward. And then the only way to do that is to work together.
Yeah, absolutely. There's still going to be though a training gap, right? Like I like that you touched a lot on like, hey, hands-on, we have courses. I feel like there has to be though, not people that are just hanging out in Facebook groups trying to learn, right? People
Sure.
have to go and do
Sure.
things. I also like the fact that online learning has its place, but I feel like we're really getting to a point now where we need to, like you said, like come together in groups, see those things. Why do you think that there's still a gap in like our education and our training?
So, that's one thing that I'm actually working with HuFriedy Group with and being in discussion with, because I think there's a huge gap between when we leave hygiene school and when we get into clinical practice. I've had the privilege of being the dental hygiene director in my practice, and it's fascinating to watch. I never had a hygienist work over me and say, all right, you've just left your operatory from school. Now you're in a real life world. Let me help you. And the beautiful thing is my boss said, this is what you're going to be doing. And I was like, oh my gosh, this is a dream job. So my first day, I worked with a dental hygienist who had never treated a patient outside of school. And I didn't want to be standing over her. I didn't want it to feel like you are in hygiene school and everything you do is being graded. And where is your overall sticky barrier? And what does this look like? And what did you just do with that suction? You didn't bend it correctly. And I think a lot of us, especially me, I grew up with so much trauma in the dental hygiene world. And my professors were great. They wanted to set me up for success, but I remember feeling like I was walking on eggshells. And I can't tell you the last time until recently that I actually paid a ultrasonic expert. I paid Noelle Paschke to come in. And when I say paid, she wouldn't let me pay her, so I actually brought her lunch. But I tried to pay. I should say I tried to pay.
You compensated her
Noelle,
in some
yes,
way.
we had a play date with Noelle to make sure that I was being a good steward of all the content that I put out on Instagram. Is my angulation right? Correct me, because I can only see, I've been in my op and I've been siloed. I don't have a trainer over me, right? And I think that's the difference. It's really hard to admit that we don't know what we don't know sometimes. And it can feel embarrassing because we're used to an environment where you had to be perfect. Where I think that's the beauty in hands-on courses when you have the right instructor. We're not here to shame you. What do you not know? And just the smallest of tweaks. And sometimes you just need to visually see it, because what is 0 to 15 degrees against each tooth? What if it's more lingual? What if it's more buccal verted? How do you handle that? So that's what I'm excited to really be building in the future of teaching hygienists these and focusing more on hands-on, where I can empower those hygienists of here are the steps. The beautiful thing with this other hygienist that I do want to kind of circle back to is watching her, and her film placement was absolutely fantastic. Her FMX was great. So I was standing in the hall and pushing the button for her as she's doing her FMX, and I have tears streaming down. And my doctor is like, what is happening? I'm like, I'm just so proud of her. And I'm like, oh my God, way to get that Apex girl. And the patient loves it. And it's just this environment. And I'm so
Yeah.
grateful to have, now be in an environment where I truly feel like I can be myself. I can support. Patients love it. Patients are competing with each other when we disclose them. Like, one patient in my room will be talking smack to their spouse in the next room about, oh, I bet you have a lot of plaque today, and back and forth. And like, who won? Who won? So they create a competition, they get engaged. And the reality is we've got patients who are vested in their health in a really non-judgmental way. And the most beautiful moment that I've had this whole calendar year was standing there with the hygienist on her first day, writing her note. And she looked at me and said, okay, you can sign it. And I said, I don't have to sign it. And she just looked back at me. I looked back at her. I said, welcome to hygiene.
Graduated.
So, and that's what we
Yeah.
all need,
Yeah.
right? We all need that mentor, no matter how many years we've been doing it. We need each other to sit and say, hygiene's hard. working in this profession is hard. Let's figure out how we support each other, and let's figure out how we progress forward with the tools, present it professionally, know what the doctor's looking for to say yes. And I'm here to help with figuring out how you do that.
And you make it fun. That's the whole dentistry is missing the fun a lot of times. Okay, so last question as we kind of wrap this up. Like, let's say that pie in the sky, we have all of our tools, we have all of our processes, we have all the things in place. What does it look like in 5 years from now when we are now doing the right thing the right way?
Oh, my goodness. Well, it starts with insurance reform.
Okay.
Okay. That's a whole other podcast.
Is that 5 years from now? Okay.
I would love it to be 5 years.
Okay, so we're pie in the sky it, though.
We're pie in the sky. Yeah. So insurance reform, number one. Number two, I think it looks like figuring out how we expand the profession, right? So the reality is if dentists are having a hard time hiring hygienists, we have to say why. Why are you having a hard time? What do your instruments look like? When was the last time you replaced your tips, whether it's a magnetorestrictive versus a piezo versus an air polisher? What type of instruments do you have? Are you putting them in a cassette? I was temping, and I will never forget this moment where it was a beautiful HuFriedy cassette when I got there. And I was like, oh my gosh, this is great, HuFriedy, all right. And I opened it, and there was corroded instruments that were blue and black and mixed in with these beautiful HuFriedy group instruments. And I brought it to the doctor, and I said, this is what's happened. This is the difference in quality of your instruments. And he said, oh my gosh, okay. And, that was the end of the conversation. Next patient, he comes in and he was like, oh, looks like you found a good cassette. And I was like, oh, I brought my own cassettes. And he was like, what? And I said, yeah, I own this. So it's also having those conversations too of what are we putting in the patient's mouth? We have to move away from not just production, but doing what's right for the human, doing what's right for the patient. If up to 50% of heart attacks and strokes are triggered by oral pathogens, we need to be treating the patient differently. So pie in the sky, insurance reform, pie in the sky, really looking at how we present ourselves to get the respect that we deserve.
Absolutely. All right, call to action. What should the hygienist do if they're listening to this episode? Where can we send them?
Absolutely. So if you want the kind of unfiltered, how do you do this? How do you overall start with air polishing? How do you talk to your doctor about it? You can reach out to me personally, amberaugerrdh at Gmail or amberauger on RDH on Instagram. And then I would highly encourage you to set up a demo. I would highly encourage you to meet with a HuFriedy group representative in your area to be able to see this technology. It's different. It's got constant air flowing through it, so it doesn't clog. I've been trying to clog mine since last August, and I haven't been able to achieve that yet, which is absolutely amazing. And I would say, any way that I can support you, let me know. I'm here to ensure that you have a career that you love, and I never want you to feel stuck. And I want to teach you honestly how to love chairside hygiene. If I could do it full time every day, I would. It's my favorite day of the week, but my carpal tunnel has me diversifying my career.
Awesome. Well, thanks for being here. I appreciate it.
Of course. Thank you. And again, thank you for my friends at HuFriedy Group.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.